So good afternoon, ladies and gentlemen, from the Arcadian Court in downtown Toronto. Welcome to the 112th season of the Empire Club of Canada. For those of you joining us through either our webcast or our podcast, welcome to this meeting today. Before our distinguished speaker is introduced, it gives me great pleasure to introduce you all to our head table. I'd ask that each guest rise for a brief moment and then be seated as your name is called, and I'd ask that the audience refrain from applauding until all head table guests have been introduced. So, in no particular order, the Honourable Mitzi Hunter, Associate Minister of Finance, MPP, Scarborough-Guildwood. Mr. Ted Griffith, Senior Consultant, Principal, Campbell Strategies, and the third Vice President of the Empire Club of Canada. Ms. Anne-Marie Applin, the President of Applin Marketing and a Director of the Empire Club of Canada. Ms. Leah Hollins, Board Chair, Canadian Blood Services, and a recipient of the Order of Canada. Mr. Robert Brower, Canadian Managing Partner, Clients and Markets, KPMG. Dr. Graham Sher, Chief Executive Officer, Canadian Blood Services. And my name is Gordon McIver. I'm the Executive Director of the National Executive Forum on Public Property. Ladies and gentlemen, your head table. Also gives me pleasure to acknowledge the presence in our live audience today of a couple of special guests. I believe Bill Morneau, the federal Liberal candidate for Toronto Centre, is with us. Bill. And Han Dong, the MPP for Trinity Spadina. Welcome, gentlemen. Now, ladies and gentlemen, please welcome Mr. Rob Brower from KPMG to introduce Dr. Sher.
Thank you, and good afternoon, folks. KPMG is delighted to have this opportunity to sponsor Dr. Sher's presentation to us today on collaboration and leadership for innovation and better value in healthcare. KPMG, as one of the leading healthcare consultancies globally and in Canada, is committed to working with governments and healthcare providers all over the world to helping to improve the performance of healthcare systems all over the world. Canada is well served indeed by Canadian Blood Service, which Dr. Sher has led for the past 14 years and has shown itself to be a leader in innovation and collaboration, working with and serving the needs of all of the provinces and territories in Canada except Quebec. Dr. Sher and Canadian Blood Services recently announced another major milestone for Canada, the successful launch of Canada's own public stem cell cord blood bank, a critically important initiative for all Canadians. Dr. Sher has been with Canadian Blood Services since it began operations in 1998 and has led the transformation of that organization as CEO since 2001. Dr. Sher is a globally recognized leader on healthcare innovation, sits on a number of blood system and healthcare-related boards and advisory bodies, and has provided consulting support to other countries in the transformation of their blood systems. He is a passionate advocate for healthcare system performance improvement and policy development, and speaks from a platform of success at CBS. A hematologist by training, Graham acquired his medical and doctoral degrees in Johannesburg and his specialty certification on staff at the Toronto Hospital. He was there a physician and on faculty at the University of Toronto. Outside of his professional and family life, Dr. Sher is also an avid photographer, and I can personally attest, as I am fortunate enough to have one of Dr. Sher's works, that not only is he avid, he is also pretty darn good. So with that, ladies and gentlemen, I give you Dr. Graham Sher.
Thank you, Rob, for that very kind introduction, and thank you to the Empire Club for the opportunity to speak here today, and welcome to all our special guests. As I was saying to some folk just before the event started, I'm glad that the Blue Jays are not playing this afternoon. Go Jays, go. You likely know Canadian Blood Services as the organization that manages the country's blood supply system, and this is no small task. We operate a national system spanning all the provinces and territories of Canada except Quebec, which has its own blood system, and we are responsible for meeting the needs of hospitals and patients right across the country in terms of blood and blood products. We do this through our 4,300-strong employee base, operating out of 40 facilities from coast to coast, and relying on a donor base of over 425,000 Canadians. Our revenue, derived from the provinces and territories, is just over $1 billion annually. Given the legacy of the tainted blood scandal in Canada, from which our organization was created, our singular focus at all times is to operate a system on which Canadians can rely and which they can trust. Retaining trust underscores every decision we make. Recognizing that our name, Canadian Blood Services, emphasizes our responsibility for the blood program, it is less well known to many that we also bulk purchase a portfolio of plasma-derived drugs and related biologics worth about $500 million annually, that we manage the one-match stem cell and marrow network for Canadian patients needing a stem cell transplant, that we operate Canada's national public umbilical cord blood bank, and that we lead aspects and collaborate in a national system for organ donation and transplantation. Our unique value proposition to the federated health systems that exist in Canada is precisely this. We are the only federally regulated, provincially and territorially funded, pan-Canadian healthcare delivery organization. As we near the end of one of the longest and most contested federal election campaigns in many years, I am struck by how little healthcare matters have been part of the election discourse. While there is finally some discussion on healthcare within the election debate, the amount and the depth of that dialogue is, in my opinion, not in line with how Canadians view healthcare as an important matter to their lives. In the recent report from the advisory panel on health innovation led by Dr. David Naylor, several important themes were raised, such as greater collaboration for healthcare innovation, better value in the procurement of drugs, refocusing the healthcare systems on patients, and innovation to enhance the quality and sustainability of health systems. The Pan-Canadian platform from which Canadian Blood Services operates affords us a unique perspective on health system issues in this country, and I want to explore some of these themes today, both because they resonate strongly with our vision at Canadian Blood Services and because we have experiences that can usefully inform these debates. I'll start to do that by sharing two patient stories that showcase improved health system performance and patient outcomes, as well as equity and access to care. I've chosen these stories among so many important ones because they stand out of examples of what can be done from greater collaboration for healthcare innovation. The first story is about Eileen. She needed a kidney transplant. Unfortunately, Eileen relied on dialysis for 15 years because of the challenges brought to bear by her highly sensitized immune system. Sensitization happens when patients are exposed to other people's tissues through previous pregnancies, organ transplants, or blood transfusions. Like hundreds, if not thousands, of other Canadians experiencing kidney failure, Eileen developed antibodies to these foreign tissues that prevented her from finding a potential match within the limited number of organ donors available for transplant in her region. This past April, however, her transplant finally happened. A suitable kidney was identified from a deceased donor through a program called the Highly Sensitized Patient Program, or HSP. This is a new pan-Canadian organ-sharing program developed by Canadian Blood Services in collaboration with provincial organ transplant programs and health system partners and ministries across the country, including Quebec. This is a truly pan-Canadian program. In recent months, the HSP program has given real hope to highly sensitized patients like Eileen, who typically wait the longest for kidney transplants. This program gives these patients priority access to a broader national pool of organs for transplant, as opposed to the smaller pools of organs available within provincial or regional health systems. Provincial organ programs support this prioritization because the greater size of the national organ pool gives this disadvantaged group of patients a more equitable chance at finding a match. I'm pleased to say that Eileen is one of almost 150 people who received a kidney transplant since this innovative, nationally cost-shared program began less than 2 years ago. Without this pan-Canadian approach, these 150 patients would likely to continue to live decades of their lives on wait lists and heavily tied to their expensive dialysis regimens. The HSP is the latest addition to the Canadian Transplant Registry, which is home to 3 programs for interprovincial organ listing and sharing, the Kidney Paired Donation Program and the National Organ Waitlist being the other 2. The Canadian Transplant Registry is a perfect example of pan-Canadian innovation and collaboration. It is managed independently at a national level. It enables the work of provincial organ donation and transplantation programs, each of which is able to retain jurisdictional delivery and local decision-making, while working collaboratively toward and ensuring national performance standards. In managing the infrastructure for this web-based system to organ donation and transplantation, Canadian Blood Services is guided by interprovincial policy as well as evidence-based leading practices that have been developed collaboratively with health system partners. The Canadian Transplant Registry is about building bridges across silos. It is about sharing scarce resource across provincial jurisdictions and acting together as a single nation to improve access. Within this context, innovation means thinking differently about our health systems and scaling up solutions at the national as well as at the provincial levels for the benefit of all patients. In bridging these silos of provincial health systems, innovative solutions such as the Canadian Transplant Registry neither undermine nor diminish constitutional and jurisdictional boundaries. Rather, they refocus health systems on the needs of patients, they promote sustainability, and they add value. Simply put, they allow the Canadian healthcare system, if one believes there is such a thing as a single Canadian healthcare system, to achieve levels of performance that no single provincial system could achieve on its own. For every kidney transplanted in Canada, studies have shown that there is a cost avoidance of approximately $50,000 per year per patient. Given that to date more than 360 people have received transplants through the Kidney Paired Donation Program, the most mature amongst the Canadian Transplant Registry, we estimate that roughly $18 million annually is now able to be redirected to other health system needs. Some of you may have seen media coverage recently about a patient awaiting his kidney transplant through the Canadian Transplant Registry. Noting that the story did not give the full context and picture, it is true that from time to time challenges may occur in transplanting very hard-to-match patients in a timely basis. The second story I want to share with you is about Reg. He was born with common variable immune deficiency. Throughout his childhood, he suffered from many serious infections due to this condition, and at age 14, he began monthly infusions of intravenous immune globulin, or IVIG, to help protect him from these infections and keep him alive. In his early 30s, Reg was diagnosed with sarcoidosis, an immune disorder involving growth of tiny collections of inflammatory cells in different parts of the body. In Reg's case, his lungs were devastated, and he began taking IVIG every 2 weeks instead of monthly. In his mid-40s, Reg's lungs and liver failed, and after multiple life-threatening complications, he had a double lung and liver transplant in March of 2014. Reg has had a pretty rough ride. Without regular treatment with appropriate medications, he likely would not have survived into his 40s, let alone manage the lung-liver transplant. Today, he continues to battle these infections that require multiple platelet infusions as well as ongoing treatment with IVIG. IVIG is a life-saving drug derived from human plasma. Since its inception in 1998, Canadian Blood Services has provided universal access to expensive biological drugs such as IVIG to all patients in need across Canada. There is no question of inability to access these life-saving drugs and no differential access across jurisdictions. This means that if Reg moves to another province, he'll still have access to the medicines he needs to survive. Reg's freedom to do this stands in stark contrast to the experience of other patients who often face unintended but potentially debilitating postal code lottery consequences when it comes to access to certain medications. Canadian Blood Services provides this pan-Canadian service through a bulk purchasing program that leverages capabilities within the blood system to achieve best prices for these biological drugs on behalf of the provinces and territories, while driving added value into the process. This approach, however, is about much more than simply bulk purchasing to supply the 700-plus hospitals we serve in Canada. It also creates a pan-Canadian platform from which we deliver multiple benefits to the provincial health systems. These benefits include a comprehensive operating system for the acquisition, warehousing, and delivery of biological drugs, a publicly tendered RFP process focused on cultivating diversity and security of supply, additional layers of safety, quality assurance, and risk management, medical expertise and leadership in appropriate utilization of these products, enhanced patient and stakeholder involvement in product choice, and of course, the proven negotiating power for cost efficiency. These are all things that Canadian Blood Services is able to bring to the table on behalf of the stakeholders it serves. Equity of both access and quality on this pan-Canadian scale seems unusual in today's healthcare system, doesn't it? Likely so does Canadian Blood Services' integrated approach to the national service delivery, which helped enable Reg's access to IVIG, platelets, and organ transplants when he needed them most. Here, too, innovation means thinking differently about health systems. Within the context of bulk purchasing, it means being more than a clearinghouse for best prices by building policy-driven, value-added services into the practice. Within the context of integrated national service delivery, it means leveraging pan-Canadian platforms to help patients receive optimized care, a continuum of preventative and curative services according to a patient's need over time and across the different levels of Canada's health systems. Eileen and Reg's stories are real. Their experiences are windows into our organ donation and transplantation and bulk purchasing programs. But these are only two of our offerings. In fact, all of the organization's programs and services have one common essential factor: an ongoing commitment to cross-jurisdictional collaboration in health service delivery. I'd like to speak more broadly for a moment about how this commitment became and today remains a reality. And as I do that, I will continue to explore the other themes I raised at the beginning of my talk: innovation, equity and access to care, and ultimately better value to both healthcare systems and patients who rely on these systems. In the case of biological drugs, equity of access is the norm in Canada because of a policy decision made by federal, provincial, and territorial governments in 1997 when they were reforming the blood system at the height of the tainted blood scandal. At that time, governments chose to establish something unprecedented and unique to operate across Canada's provincial health system and the service delivery silos: a pan-Canadian, cost-shared, patient-centered system where blood and blood products are collected, manufactured, procured, and distributed nationally. A system where blood products, and stem cells for transplantation remain available to all patients at no direct cost. Whether they live in Edmonton, Alberta, or Edmundston, New Brunswick, these biological products are accessible within the country's insured health systems. This pan-Canadian approach required political courage, leadership, and collaboration from both federal and provincial governments. It required a governance framework that challenged jurisdictional orthodoxies and which today requires constant nurturing in order to remain relevant, viable, and sustainable. Canadian Blood Services is regulated by Health Canada under the Federal Food and Drugs Act and is funded in large part by the 12 provinces and territories we serve. The health ministers of the 12 jurisdictions, as corporate members or shareholders of Canadian Blood Services, appoint our board of directors. The organization is an independent, arm's-length, not-for-profit corporation, and most importantly, is not an agent of any one government, while it remains accountable to the collective of the provinces and territories we serve. Within this governance framework, decisions can be made free of political and jurisdictional constraints, striving only to deliver the right service or the right product to the right person at the right place and at the right time, rather than being rooted in individual jurisdictional boundaries and priorities. Delivering on our mandate this way leaves us free to maintain operations where they are needed to best serve patients and where they provide optimal value to the health systems. Supported by this governance structure, the universal access to over 35 biological drugs enabled through Canadian Blood Services bulk purchasing program, in effect, achieves many of the requirements of a national pharmacare program for some patients. Driving system performance improvement at the national, pan-Canadian level is not easy, and progress can sometimes be frustratingly slow. I described some successes in the area of organ donation and transplantation, such as the Canadian Transplant Registry, improving access to organs for those patients hardest to match. While a national system for organ donation and transplantation is taking effect, organ donation and transplantation has not benefited from the wholesale reform that we saw with the blood system starting in 1997. Levels of performance and regional disparities in access remain a problem today. The numbers make it clear that more must be done. Nationally speaking, in terms of per million population of deceased donors, Canada's performance is still half that of top-performing nations and still trails countries with far fewer health resources than our own, including Latvia and Uruguay. Canada is most certainly not owning the podium when it comes to organ donation and transplantation. According to the Canadian Institute of Health Information, as of December 31, 2013, approximately 4,400 patients in Canada were on wait lists to receive a kidney, lung, heart, liver, pancreas, or bowel transplant. In that same year, 2013, 245 Canadians died while waiting for a transplant. That's about one every 36 hours. As someone who is committed to improving health system performance, and as we celebrate World Day of Organ Donation and Transplantation later this week on October the 17th, I find those numbers awfully hard to accept. Adding urgency to the situation is the growth of dialysis in Canada. Dialysis use is exploding as the population ages and as the number of people with diabetes and end-stage kidney disease rises exponentially. For a variety of reasons, it is unlikely organ transplants will ever be as universally available as blood products. But we can do more to plan for what we know is coming. Although Canadian Blood Services is well positioned to support and facilitate further interprovincial collaboration, both continued investments in frontline provincial delivery and governance are needed for the organ donation and transplantation system to gain more ground in this country. The broader point I'd like to make with these stories of patients and the programs that serve them is that under the right circumstances, federal and provincial governments are able to do more together than either can do on their own. While healthcare necessarily falls under provincial jurisdiction, federal, provincial, and territorial governments can and do collaborate for improved health system performance. Canadian Blood Services' experience is the proverbial proof in the pudding. Together, governments can think differently about how health service delivery programs empower innovation across jurisdictions for the benefit of all patients. It should not take crises or failures in health systems, such as was the case with the blood system in the mid-1990s, for governments to convene key stakeholders from across the country and collaborate in the spirit of leadership and consensus. Visionary policy decisions that lead to decades of great value for health systems and Canadian patients can and ought to be made using evidence as a basis, prior to imminent system collapse, and unconstrained by orthodoxies and traditions. As we face the dual realities of fiscal restraint and an aging population, we as health system leaders and partners have a crucial role to play to promote innovation and improve health system performance. In addition to the examples I've spoken about in our biological program and the Canadian Transplant Registry, for Canadian Blood Services, leadership and innovation also means mobilizing knowledge and experience to enhance value and to effect sustainable performance improvement across systems. As an example, our organization championed and led the development of an international risk-based decision-making framework, doing so through the Alliance of Blood Operators, a network of over 90 blood system operators from Europe, North America, and Australia, of which Canadian Blood Services was a founding member. The result of this international collaboration and innovation is a pragmatic and principled, internationally applicable framework that better guides major policy and operational decisions regarding blood safety, and which takes into account evolving technologies, societal issues, health economics, and stakeholder expectations. When I began my talk today, I referred to the recent report from the Advisory Panel on Healthcare Innovation. One of the main points from that report is that within and across our provincial health systems, we have trouble scaling up innovative, successful solutions to the problems we face. Serious trouble. We have no shortage of innovative thinking or functional solutions, but often we are unable to work together to achieve breakthrough performance. I believe today's arm's length management of our business and the experiences of patients like Eileen and Reg stand as an example of what's possible when we do scale up. Innovative leadership in Canadian healthcare is about doing things differently and setting up conditions for success. In Canadian Blood Services experience, this has taken place through the pan-Canadian collaboration, making the whole more than the sum of its parts. This is not to say that the approach is easy or that there should be a national solution for every healthcare problem we face. As many of you with experience in interprovincial relations will know, differing political realities and fiscal constraints across the country make collaboration and decision-making highly challenging by nature. But collaboration, coordination, and consensus are doable, and their dividends are what we all strive for: better health, better system performance, and greater value for Canadians. So no matter who is in power federally after October 19th, I urge them to look at what's working within Canada's health systems and forge ahead. Together with its provincial and territorial counterparts, the federal government can play an essential role in enabling and replicating successes. And where there are gaps in value, equity, and access, I hope that our next federal leaders will seriously consider innovative calls for renewal and promote innovation to bridge the divide. Leadership and collaboration across jurisdictions can be game changers in creating better, more equitably accessible healthcare in Canada. Let's have the courage to move beyond the current paradigms and build more bridges across silos. Together, we can deliver the kind of healthcare that Eileen and Reg are counting on. Thank you very much. And I guess I would be remiss if I didn't take this opportunity as the CEO of Canadian Blood Services to say there are many ways you can all get involved. Become a blood donor, stem cell registrant, organ donor, sign your organ cards, become a corporate or community partner, support us financially, volunteer. We're all counting on your help. Thank you very much.
Thank you very much, Dr. Sher. And ladies and gentlemen, Dr. Sher has kindly agreed to take a couple of questions. I think we have a little bit of time, so let's open it up. And I believe we have a roving microphone there. So if anyone has a question, just raise your hand. Well, I actually had one, so I'd love to ask it. Just obviously, no one in this room would ever ask the question why Quebec is not served by Canadian Blood Services. We understand that politically. But what is the difference? Is there any difference in the services that they offer to their jurisdiction? And between the two of you, do you have some kind of a best practices exchange in place?
Yeah, so I won't answer the first part of the question in the interest of time. But they do operate a provincial blood system, almost identical and analogous to what we do across the rest of the country. The same products, the same services, their market space being the hospitals and patients in Quebec. There are numerous very close agreements and collaborations between Canadian Blood Services and Hema-Quebec. We have shared supply agreements, we have a collaborative research and development agreement, and we have several mechanisms whereby products can be moved between the two jurisdictions. We both operate under the same federal regulations and have to achieve the same standards in quality. We essentially have almost mirror operations in Quebec and in the rest of the country. And so there is regular and frequent sharing of best practices between the organizations, as Canadian Blood Services also does with its international partners. I mentioned the Alliance of Blood Operators in my remarks. We do a lot of international best practice and benchmarking comparisons to make sure that the blood system in this country is always remaining state-of-the-art. One of the findings that Justice Creever noted in his Federal Commission of Inquiry on the blood system at the height of the tainted blood scandal was that the blood system in Canada had fallen behind the international standard of care. So best practice and benchmarking comparisons are critically important to make sure that what we're doing is always on the leading edge of safety, quality, and sufficiency of supply.
Sorry, could you say it into the microphone, sir, so everyone can hear?
My name's Ian Hilly. I'm the president of the Canadian Hemochromatosis Society. But as you can guess, I was born in another country. I was just interested. I understand the roots of the Canadian Blood Service. We went through a very dreadful time in the 1990s. We have very restrictive criteria for people to make donations. Can you talk to any innovation in broadening the population that could give donations? Because we frequently see every summer a desperate campaign for more blood.
Thank you very much. Yes, I mean, the bottom line of it is we do have very rigid criteria for who can be a blood donor and who not. And our criteria, by the way, are in line with very similar criteria used around the developed world. So we have all sorts of restrictions based on people's medical condition, the drugs that they may be taking, their travel practices, their sexual practices, their health circumstances, and a long list of criteria that would deem people to be either eligible or ineligible to be a blood donor. The primary reason for that is twofold. One is to protect the health of the donor. So do they have a health condition or may they be taking a drug that if they donated a unit of blood would actually cause them harm? The second and perhaps most important, larger reason is could a donation from that individual be harmful to the recipient? We also have multiple other layers of safety. I was telling a colleague at the table that we really operate a belts and suspenders safety system in this country, as most blood systems around the world do, where the questions we ask donors is just one layer of many in the safety profile, including the testing of blood, the manufacturing, the processing, and a variety of other things that we do. So why do we continue to keep these very restrictive criteria? And it is true we lose many thousands of donors a year to these criteria. In large part because we cannot test for everything. There are many agents we don't know about, and so you have to rely on multiple, as I say, layers in the system of safety. That said, Canadian Blood Services is always revising and refining the criteria that we have in place today. The one that garners the most attention publicly and is the most controversial by far is our policy of excluding men who have sex with men. It used to be a lifetime deferral. We reduced that to a 5-year deferral now. We're in the process of submitting data to our regulator to reduce that even further to a 1-year deferral. So that's an example of where we're always applying scientific evidence and emerging knowledge to modernize our criteria, and there's many, many other cases we do the same. Until we can institute a new technology, which Canadian Blood Services is actually now in clinical trial with, a technology known as pathogen reduction, until we can introduce a technology like that, we will continue to rely very heavily on these broad, blunt instruments of asking donors a long list of laundry list of questions. But there's another technology that we're seeking to implement now that will render blood safer than it is, and therefore less reliant on some of these questions.
My question is, could you just give us a little bit more information on the cost difference between dialysis and the transplant options that are available, and maybe you could just give us a bit better detail on that.
Yeah, sure. So in health economics, the difference between remaining on dialysis and receiving a kidney transplant is probably one of the single most cost-effective health interventions that our health systems do today. And the numbers are more or less like this. Once a patient has end-stage kidney failure, and if they remain on dialysis, there is an annual ongoing cost to that dialysis program, which runs in the many, many tens of thousands of dollars per year per patient. So that's the cost of the equipment, the disposables, the medical staff to provide the dialysis. Plus, there is also tremendous lost quality of life when individuals are tethered to the dialysis instruments multiple hours a week. But the costs are in excess of $60,000 to $80,000 per year per patient. A kidney transplant is a one-time, very expensive intervention. So a transplant can cost north of $120,000 in today's healthcare systems, but that's a one-time cost. And thereafter, if the transplant is successful, the only cost that the patient incurs is the ongoing costs of their drugs to prevent rejection. But there are numerous health economic studies done all over the world, including in Canada, that show as you then carry out years post-transplant, the differential between remaining on dialysis and that one-time cost of the transplant amounts to about a $50,000 saving to the healthcare system, or cost avoidance, I think is probably the more accurate term, a $50,000 cost avoidance per patient per year for as long as that transplanted kidney remains viable. So certainly on a health economic basis, kidney transplantation versus dialysis is a highly effective intervention in freeing up resources to be applied to other patients needing those resources.
Hi, my name's Ken Hughes. I'm the CEO of ITP Biomedica, a diagnostic company, and I'm also not born here. Back to the issue of
that's true for a lot of us.
Exactly. Back to the issue of donation. I, like you, find it absolutely outrageous that people die waiting for donations because people haven't signed their donor card. How would you approach improving participation for the poor unfortunates who could be donors in this regard, be it presumption to donate, or indeed just a better education process? Because right now people are dying because of a combination of political correctness and being bone idle.
Yeah, that's a very good question. So two problems I think are prevalent in Canada at the moment. One is we have a provincially based donor registration. We're talking about organ donations here. So every province operates its own system. In some provinces, it's a driver's license signature. In some, it's an online registry, such as we have here in Ontario and in British Columbia. So there's a potpourri of different ways that donors can register to be an organ donor across the jurisdictions. The second problem is there's no automatic availability of that information at the point of care. So if, heaven forbid, you're an Ontario citizen, but you're involved in a motor vehicle accident in New Brunswick, there is no immediate knowledge that you have signed up to be an organ donor. So what we have not built is those interoperable systems in this country, or, in fact, a single pan-Canadian registry for all organ donors in the country. The second problem is that even if you have indicated your consent to be an organ donor, what families often do is override the wishes of their loved one at the time of grief and when obviously their family member is imminently dying. And so what is missing is what the physician colleagues that we work with in the intensive care settings call a culture of donation. We don't have a lot of physicians and nurses trained in the intensive care to have the very difficult conversations with families in their time of grief, to go up to them and say, you know, your loved one had signed their intent to be an organ donor, and we really need to move quickly now in order to retrieve those organs. Many physicians and nurses are reluctant to have those conversations. And we are noticing in the provinces and in the regions where physicians have really taken an active step to get involved in promoting organ donation, the rates of organ donation are a lot higher. So there's both the registry pieces, but there's also the culture of donation piece. And the third comment I would just make is there, because you raised it in this notion of presumed consent, there are some countries in the world that have enacted legislation where every citizen is automatically presumed to be an organ donor unless you opt out. So it's the negative cable billing phenomenon. So countries, Luxembourg, Portugal, Spain, a number of European countries have it. The United Kingdom looked at the whole notion of presumed consent and decided not to adopt it. We have actually done several times over the past few years polling of the Canadian public, and it's just about 50-50, almost less than half of Canadians are actually in favor of presumed consent. There's this whole notion that the state will take control of my organs. So even if we were to implement presumed consent, it's not necessarily the panacea to the problem. Countries like Spain, which actually has the highest rate of organ donation in the world, acknowledge that presumed consent helps, but it's the culture of donation they've created in their institutions that really drove system performance improvement. So it's a very interesting societal debate that we as a society have to come to terms with. As you say, many of us signal intent, but then the action doesn't get carried through for a whole variety of reasons that are not optimized within the system. Another reason for collaboration across jurisdictions.
Okay. Well, thank you very much.
Thank you very much.
Thank you. Here to express our collective appreciation, please welcome Ted Griffith.
Thank you, Gordon. Thank you, Dr. Sher. I'm in a rather unique position. Not only am I the vice president of the Empire Club, I used to be an employee of Canadian Blood Services when it first came into being in 1998. So I'll apologize for a moment where once you're a blood donor recruiter, you're always a blood donor recruiter. So I can probably make a little pitch that's a little bit stronger than the genteel notion of the CEO, the president and CEO. That I'd like to ask a question here is how many people in the room are blood donors? Wonderful. How many of you in here who are not blood donors would consider yourself healthy people? Thank you very much. Names and numbers will be taken at the back door. The organ donation as well. See, again, when I was involved, this is what I was astonished with this presentation because I left the blood system in about the year 2000. And I am so excited to see CBS take its position of being this national pan-Canadian organization which is sharing knowledge, making the system more efficient, providing more value system for it, because you've become the most prominent healthcare service delivery organization in the country. And we need to take more pride in it. We need to learn from that. Collaboration in the healthcare system is not as much as it's a place where it has the most benefit and sometimes has its own barriers. I'll tell one quick story. When I was charge of blood donor recruitment in Vancouver, I've always learned that cancer patients need blood. And so I went and I was putting together a program, and I was getting endorsements from various people about donating blood. So I contacted the BC Cancer Agency. A friend of mine had a similar role there, and said, "Okay, I'll poll some doctors for you, get some quotes, no problem." And the answer came back: blood donations have nothing to do with cancer treatment. And then I was explaining, of course, they were right, because they're oncologists and they deliver chemotherapy drugs, etc. But of course, what those oncologists weren't seeing was that if somebody did not have enough red blood cells in their system, they could not receive the chemotherapy. So those two little points we had to work hard to bring together in a small place like British Columbia. It's very... So I will mention, I say it's exciting to see that I think this, when I hear stories that people are dying for lack of blood, lack of organ transplant, and it's because we don't have a national system to put it together. It seems, I'm sorry to say, downright shameful. This country needs to work together in all ways. It benefits when it works together in all ways. We have no higher calling than taking care of our children and our health for the rest of our lives. And I wish to congratulate Canadian Blood Services for the work you're doing in leading us in that basis. And I would encourage everybody to, first of all, donate blood or be a volunteer. That long laundry list now you have to deliver to people. But please, it's a great organization, and Canada is now leading, as opposed to when I became involved when we were playing catch-up by leaps and bounds. So congratulations, Dr. Sher, and thank you very much.
Thank you, Ted, and thank you again, Dr. Sher, for an excellent presentation. Thank you for our generous sponsors today, particularly KPMG, for sponsoring this event. We'd also like to thank the National Post, which is our national print media sponsor, and a special thanks as well to mediaevents.ca, which is Canada's online event space for live webcasting today's event at a global level. Follow us on Twitter, ladies and gentlemen, at empire_club, and please visit us online at empireclub.org. You can also follow us on Facebook, LinkedIn, and Instagram. We've got a lot of great events coming up in the coming weeks. We hope you'll be able to join us. Tomorrow, we welcome the President and CEO of Canadian Tire, who has decided he wants to speak to the country about the great challenges in the new digital economy, particularly for Canadian retailers. We have Glenn Murray, just to mention a few. Glenn Murray, the Minister of the Environment and Climate Change, who will be here on November the 5th. The Governor of the Bank of Canada is coming on December the 8th to talk about where we are going in the next year as an economy. And on Friday, we just booked Chief Justice Beverly McLaughlin, head of the Supreme Court of Canada, who will be here a little bit later in the year to talk to us about how the Supreme Court fits into the Canadian government. Thank you very much for your attendance today, ladies and gentlemen. This meeting is now adjourned.